Well, Brugada syndrome, we call it a syndrome because it's an association of an electrocardiographic pattern and symptoms like sudden death, aborted sudden death, or syncopes. Now we have also the problem of atrial fibrillation in Brugada syndrome. In fact, actually, we should call it in some cases not only Brugada syndrome, but Brugada disease, because in the patients where the mutations are known, we have the cause of this syndrome, so that's a disease. And there is another problem, which is very important, is you have patients that have this electrocardiographic pattern, but who do not have other symptoms. And of course, then we cannot talk about Brugada syndrome. We should talk about a patient with an electrocardiographic pattern of Brugada. Yeah. So that's a little bit the present situation, and I think that this will change very fast in the future thanks to the new genetic techniques. Well, we have no exact idea of how frequent this disease is. In fact, there are very, very different statistics depending where you look at, for instance, children, or you look at adults, whether you look at the Western world or you look at the world, for instance, of South America or Thailand or Japan. So it can go, we believe that this must be something around 1 in 1,000 clinically, let's say, that is recognized. Which might be an exaggeration also, or might be just an underestimate, we don't know exactly. If you look at genetics markers for Brugada syndrome, there was a study done in Denmark that suggests that 1 in 23 people where the wide genome analysis was done had markers, I don't say that they have the disease, but markers for Brugada syndrome. So I think that will require a lot of investigation in the future. What is very clear is that there is an increasing amount of patients with suspected or documented Brugada syndrome that are being recognized, and this is becoming a real epidemic in many hospitals and in arrhythmia centers for sure. Well, the first reason to come to Vall was to visit my friends. That was the first reason, and then discuss a little bit of science, and we discussed not only about Brugada syndrome, we discussed very interesting patients that we encounter also in our country, patients where we exactly do not know what is the best approach at the present time, patients where we are afraid that something might happen, but where still the scientific tools that we have at the present time to take decisions are very limited. We have had a lot of progress in medicine since the end of the Second World War, particularly in cardiology, particularly also within cardiology and rhythmology. The world has changed enormously. The increase in knowledge is really progressively increasing, but in a very fast way, but still we have a lot of research to do. And that's why we get together, the doctors, to discuss these things and see how we can work together in the future also to solve the problems of our patients the fastest and the best as possible.